case here that microbes within the gut do influence brain function and mental health. It may come as a surprise for some of you to know that we have approximately 1 kilogram of bacteria in our intestine, largely in the large intestine. And of course, that's approximately the weight of the human brain. Now, many of these bacteria still remain unculturable, but we're able to sequence their genomes so we know that they're present. So about 1 kilogram of bacteria. I think from a psychiatric point of view, it's interesting that most of the key neurotransmitters in the human brain can be produced by bacteria. So we've done a lot of work profiling lactobacilli that produce GABA. We know that monoamines can be produced by bacteria. Most of the key neurotransmitters are. Now, I'm not for 1 second suggesting that bacteria in the gut produce neurotransmitters and somehow these transmitters get to the brain. That clearly is not the case. But nonetheless, these neurotransmitters in the intestine can influence brain function, as I'll show you in a moment. Now, how do microbes in the gut influence the brain? There are several routes of communication. And these routes, of course, are bidirectional in the sense that the brain also influences the bacteria in the intestine. First of all, there are short-chain fatty acids like butyrate, propionate, acetate, and these are produced as a metabolic consequence of microbial activity, and they do enter the bloodstream. There's increasing evidence to indicate that, for instance, butyrate might have antidepressant activity. We know that tryptophan can be produced by bacteria within the intestine, and clearly our brains have very limited capacity for storing tryptophan, so in order to maintain normal serotonergic transmission, we do need tryptophan from the gut, and the microbial activity of microbes within the gut undoubtedly produces tryptophan. The vagus nerve is an important route of communication also and provides signaling in both directions. And then, of course, we know that cytokines produced at the level of the gut do in fact travel through the bloodstream and can influence the brain by signaling across the blood-brain barrier or by directly influencing the brain in those areas where there isn't a blood-brain barrier. Now, we can manipulate the microbiota in a variety of ways. I'll talk a little about probiotic manipulation. There's increasing work being done using antibiotics like minocycline, and there is some evidence that minocycline may have an impact not just in depression, but may have an impact in schizophrenia as well, minocycline being the tetracyclic. And of course, one of the areas that is gaining prominence in medicine overall is fecal microbiota transplantation, and one of the other speakers is going to deal with that. Now, the animal model I've been using in the lab for the last 13 or 14 years is the maternal separation model. And what we essentially do is, when animals are born, between day 2 and day 13 postnatally, we separate the pups from their moms. We put them into a warm cage for 3 hours every day, and then they go back in with their mothers between postnatal day 2 and postnatal day 13. We believe that when these animals grow to maturity, they represent a good model of depression, and they have many characteristics of depression. I'm not going to go into those characteristics today, but I'm going to point out the fact that they lack diversity. They have a less diverse gut microbial system than animals that have not been subjected to that particular paradigm. And that was demonstrated by us and published in Biological Psychiatry. So I decided to look at patients attending my clinic and look at the microbiota of those patients who were attending my clinic with major depression, and to compare them with age and sex-matched healthy controls. And what you can see here is that, like the rats who have depression in inverted commas, the patients attending my clinic have a decreased diversity of microbes in their intestine. There are changes, for example, in Prevotella and other bacterial species. So there's less diversity. We then decided to do a transplant. Whoops, no, sorry. So I decided to take healthy rats and to do a transplant and to give them a humanized microbiota. Okay, so we were going to knock out the gut microbiota in these rats, and we were going to give them a humanized microbiota either from depressed patients or from healthy individuals. You can see the cocktail of antibiotics we used, and we then gave them the transplant, and they had a humanized microbiota. Now, what we essentially found is that when they received the humanized microbiota from a depressed patient as opposed to a healthy subject, they are anhedonic. Now, we look at the hedonic effects by looking at sucrose preference, and as you can see, when they have a humanized microbiota from a depressive, their sucrose preference is decreased. They also have other behavioural changes. They're far more anxious in the open field and the elevated plus maze. They have alterations in CRP. We know that CRP levels, the acute phase protein, is elevated in depression. These animals have elevated levels of CRP also. So they have, when they receive the transplant from a depressive, the phenotype transmits with the microbial transplantation, which we were very surprised with, because you don't see any alteration in the behaviour when an animal receives a transplant from a healthy subject. Now, a few years ago, I introduced the concept into the literature of a psychobiotic. It was a paper I published in Biological Psychiatry, and I defined a psychobiotic as a bacteria which, when ingested in adequate amounts, has a positive mental health benefit. It seems to be a term that is caught on in the scientific literature and the lay literature as well. The New Yorker have run articles on it, the New York Times, and John Prine and I have a book coming out with National Geographic. We signed the contract before Fox News and Mr. Murdoch took over National Geographic. We might have been less enthusiastic if Fox were owned it, but anyway, we have a book coming out on the concept of psychobiotics. So I want to show you a few different studies now. We always think in Cork that we're ahead of the posse and that we do everything, that we're first to do it. But then I come across a study that was published over 100 years ago, 106 years ago to be precise, where a physician at the Bethlehem Hospital in London advocated the use of lactobacilli for treating melancholia. So clearly we weren't the first to suggest that. But anyway, this is a study here where we used a Bifidobacterium 35624, a bifidobacterium, and what we found in rats is that it reduced corticosterone levels and it increases tryptophan levels in the plasma. So when the animals take in this bowl, they have higher levels of tryptophan and lower levels of corticosterone. The test that is used widely in the pharmaceutical industry to identify antidepressants is the forced swim test, which is based on Seligman's learned helplessness model. And you can see here, when animals are given Bifidobacterium infantis, it looks like an antidepressant in the forced swim test. It looks like fluoxetine or sertraline or any other relevant antidepressant. Now, we got a particular probiotic, a Lactobacillus rhamnosus, from a group at McMaster, John Bienenstock's group, and he felt it had anti-anxiety activity. And we gave it to rodents, and we found that yes, in behavioural tests it did have anti-anxiety activity, and it reduced corticosterone levels when the animals were stressed. So we decided to test the hypothesis that it was altering GABA receptors in the brain, and this is data from our PNAS paper. We looked at both GABA-A and GABA-B expression. I'll just show you data from the GABA-A. What we found is that GABA-A receptor expression in various regions in the brain, in the prelimbic cortex, the infralimbic cortex, the dentate gyrus, the amygdala, both the basolateral and the central amygdala, that the expression of GABA-A and GABA-B was altered. So when these animals received Lactobacillus rhamnosus, their expression of both GABA-A and GABA-B receptors was altered. So we then decided to test how this was happening. So we took some animals and we cut their vagus, and some animals we sham operated on them, and we fed them Lactobacillus rhamnosus. What we found, in essence, is that when animals were vagotomized, there was no anti-anxiety effect from lactobacillus rhamnosus, and there was no impact on GABA receptors. So the alterations that we were seeing in both behavior and neurochemistry when we fed animals lactobacillus rhamnosus was mediated through the vagus nerve, and the animals needed an intact vagus nerve. We're just completing a study at the moment with this probiotic in healthy volunteers. This is another study with the biflongum this time, and we were looking for anti-anxiety effects using the marble burying test, and this is the Barnes maze here, where the animals need to learn where the escape route is. So this is an anxiety test, this is a cognitive task. The animal needs to learn where the escape route is. And what we essentially found was that in marble burying, the biflongum, when compared to escitalopram, seemed to have an anti-anxiety effect, but it was cognitively enhancing. The animals made fewer mistakes when they were fed biflongum than when they were fed the other two treatments. So it had both anti-anxiety effects and cognitive enhancing effects. So we did a study in healthy volunteers where it was a crossover design. The subjects got 4 weeks of biflongum and 4 weeks of placebo. And we looked at both anxiety measures and we looked at cognitive measures. And what we found is when the subjects were taking the biflongum, and they didn't know whether they were taking biflongum or placebo, they reported themselves as less stressed. And when we looked at their cortisol levels in their saliva on waking, the cortisol levels were lower. So they felt less stressed and they had less cortisol in their saliva. When we looked at cognitive function, we also found, using the CANTAB, that paired associate learning and other forms of learning were impacted upon, that there was better cognitive function. Now, I'm not suggesting that this BIF is for treating Alzheimer's disease or anything ridiculous like that. These were healthy subjects, but there was definitely a modest but discernible improvement in cognitive function when the subjects were fed biflongum. And there were also EEG changes, particularly in beta wave activity. So this probiotic seems to have an anti-anxiety effect, which we found originally in rats and does transmit to humans, and it is cognitively enhancing in both rodents and in humans. Now, I want to finish up with just one other piece of data. It's a problem that we all face in our clinical practice. Why do antipsychotics cause so much weight gain? And why does olanzapine in particular cause so much weight gain? It is something we have a very poor handle on. And this is a study that we published about 3 or 4 years ago, where we took female rats and we fed them olanzapine, and they invariably put on weight. When they put on weight, we found that the ratio of firmicutes to bacteroides was increased, and that is typical of obesity. Now, when we treated the animals with a olanzapine and an antibiotic, which was vancomycin, when we co-treated them with the antibiotic and olanzapine, they put on far less weight. So basically, the olanzapine was causing a dramatic shift in the microbiota to a microbiota which is capable of generating far more calories from food. Now, another study from a different group, not ours, was looking at the issue of olanzapine weight gain. And they took germ-free animals. Now, we have a germ-free facility and we've published very extensively on germ-free animals. I'm not going to go into any of that data today because we don't have time. But what they found is when they gave olanzapine to germ-free animals who had no microbiota, they never put on weight. No weight gain in the absence of a microbiota. But when the animals were colonized and given a microbiota and then given olanzapine, they put on weight. So replicating our finding that the weight gain is at least partially explained by the microbiota. And a more recent study in translational psychiatry used young boys who were given risperidone and looked at the impact of risperidone in these young boys. And what they essentially found was exactly what we had reported in the rodents, that the firmicutes go up and the bacteroides come down. And that is a recipe for obesity, because when you have high levels of firmicutes, you generate more calories per unit of food than you would normally do. So, I've rushed a little, ladies and gentlemen, but I'm going to conclude by saying that I do believe that within a relatively short period of time, we will have a psychobiotic on the market which will be, I think, effective in treating mild forms of anxiety and mild forms of depression, and I hope you agree that that would be a significant advance if we didn't have to use antidepressants with milder forms of depression or anxiety. But I think overall, I'd like to conclude that the gut microbiota plays a very fundamental role in relation to brain development. Now, I didn't show any development studies today, although we've done many, and also brain function. Thank you very much for your attention.
Thank you very much indeed, Ted, for that wonderful opening. We have time for one, possibly two questions. Would somebody like to ask? One here. Can we have a microphone, please?
Çok teşekkürler konuşmanız için. Benim sorum şu olacak, özellikle Teşekkür ederim. Benim sorum şu olacak. Mesela anne sütüyle beslenen çocuklar ve anne sütü alamamış çocuklarla ilgili, çünkü anne sütünde belirgin miktarda probiyotik var, laktoz var. Bu çocukların ileride depresyon ve anksiyeteye yatkınlıklarıyla ilgili bir yapılmış araştırma var mı, ya da sizin bir bilginiz var mı böyle bir izlemle ilgili, veya vajinal doğumla sezaryen doğum arasında vajinal kanaldan geçerken probiyotiğe maruz kalmak ile kalmamak arasında ileride depresyon ve anksiyeteye yatkınlıkla ilişkili yapılmış çalışmalar var mı, yoksa sizin fikriniz nedir? Birinci sorum bu. İkinci sorum, hücre kültüründe probiyotiklerin etkisini çalışmak mümkün olabilir mi? Nasıl çalışılabilir? Hayvan deneyinde değil de.
Sorry, could you repeat the second question, please? I didn't catch it.
Probiyotiğin etkisini hücre kültüründe çalışmak mümkün müdür? Hayvan deneyinde değil de hücre kültürlerinde. Mesela hipokampal hücre serisinde çalışılabilir mi?
Indeed. In relation to your first question, which is a very important one, undoubtedly breast milk has a lot of prebiotics, and we know that prebiotics stimulate the development of bifidobacteria in particular. And of course, most of the formula producing companies producing infant formula are now supplementing the milk with prebiotics to stimulate the development of bifidobacteria. But we do know that the differences in the microbiota development over the first 3 or 4 years between breastfed and formula-fed babies is very fundamental, and you know, there are quite marked differences. In relation to your second question, yes, certainly we're doing studies at the moment where we have a variety of cell lines and we're exposing them to various probiotics, so it is possible to do that. There's no difficulty really.
One more question.
Thank you for your excellent presentation. I want to ask you about there is a big problem in all over the world. There is obesity, and in Turkey, I know that the percentage is get bigger, and the favorite surgery is obesity surgery. Do you know the side effect of obesity surgery after? Because I see some people. After the obesity surgery, there is restless leg syndrome, and I think their cognitive impairment became because their reaction time is get longer. But when I researched, I didn't find any research about this? Thank you.
Yeah, thank you. You've raised a very, very important point there. And there hasn't, to my knowledge, been any in-depth analysis at all following surgery. There's a lot of theoretical stuff as to how the surgery works or whatever, but really, there's been no in-depth profiling of the microbiota post-surgery that I'm aware of. I mean, interestingly enough, on the reverse side of the coin, with anorexia nervosa, you see the anorexic has bugs that tend to increase the release of calories. So it's as though the bugs are trying to keep the patient alive by increasing the calorie content of the food. But the point you raise is very important now, and we don't have any data on it at all.
Thank you very much indeed.